let's talk about something that doesn't make headlines nearly enough. Rural hospitals shutting down fast, and what that really means for all of us. So picture this. You're living in a small town in Texas, Oklahoma, or maybe deep in the Carolinas. One day, your local hospital closes its doors for good. It sounds dramatic, but this is happening in rural America at a staggering rate. And it's not just about the inconvenience. It's about life, death, and the survival of entire communities. Here's the thing. Emergency rooms have quietly become the front door to American healthcare. For millions, especially in rural areas, that ER isn't just for heart attacks or car crashes. It's where you go when you can't see a doctor, can't afford a clinic, or you've got nowhere else to turn. But here's the kicker. There's a law called EMTALA, passed back in 1986, that says every ER has to treat you whether you can pay or not. That's good, right? Absolutely. But it's also an unfunded mandate, meaning hospitals are legally required to care for everyone, but often don't get paid for it. When you add it all up, these unpaid emergency services cost nearly $6 billion a year. Rural hospitals, already running on thin margins, just can't keep up. They serve more uninsured and underinsured people than urban centers, and each unpaid bill is a small cut that adds up over time. Dr. Randy Pilgrim, who's been on the front lines for years, says it's a perfect storm. More patients, less money, and a wave of doctors who don't want to work in places that can't afford to pay them. Add in the growing violence against healthcare staff, and it's no wonder these hospitals are struggling to hire and keep talent. And let's not forget the age factor. Every day, 10,000 Americans turn 65 and qualify for Medicare. Sounds great, but for rural hospitals, it's a double-edged sword. Medicare reimburses hospitals at lower rates than private insurance, and those rates have dropped by a third since 2001 when you factor in inflation. That's a huge hit, especially for small-town hospitals already on the brink. So what happens when a rural hospital closes? People drive for hours for care. Emergencies get riskier. And when folks from rural areas have no choice, they end up flooding big city ERs, overwhelming hospitals that are already stretched thin. Congress knows about the problem. Some lawmakers, like Dr. Greg Murphy, have been sounding the alarm, calling for better Medicare reimbursement for rural providers. But so far, fixes are slow and the closures keep coming. I want you to imagine your nearest hospital shutting down. Picture the ripple effect. Jobs lost, families moving away, a community left with fewer reasons to stay. This isn't a red state or blue state issue. It's about the foundation of American healthcare, crumbling quietly, out of sight for most people, but devastating for those it touches. If you've made it this far, take a moment to think about what's at stake. Because the story of rural hospitals isn't just about buildings closing. It's about people, neighbors, friends, even family, losing their lifeline. Thanks for watching. If you care about this issue, share this video. Let's make some noise before it's too late.